not talking about my butt today, but we might be talking about my veins. Baby got veins.
Baby got veins.
You gotta dance with me. I know you dance,
They
Dr.
are just
Maida.
so round and out there.
I don't know. You should be singing this, Dr. Maida.
Should I be
Come on.
singing
Yes,
this?
you should
Yeah.
be singing it. Not only is he a cardiologist, not only does he work on vascular ugly veins like mine, but he's also the singer of a band.
Yes, it is true. We don't do that song, though. I'm not sure that I could rap that one.
I bet you could.
I probably could if I gave it a shot. But.
Okay, well, March.
Anyway, all right.
March is the next show.
Fuji Magoo. That's
Fuji
Fuji with
Magoo.
2 O's. F-O-O-J-I.
Like, incredible.
And Magoo,
Incredible.
traditional spelling.
This is what I find with doctors, is that they're so good at so many things. It amazes me.
Well, thank you.
And today, we are going to continue the journey, the big journey into the new year of my veins. And it's getting to be a good time because the weather is very cold outside.
Right. So it's a good time to wear stockings, compression stockings, and be all bundled up if you need to be for your veins. So, but before we get into all that, how are they feeling? What's going on?
My veins actually feel okay. If you recall from our last video, the reason I really decided I need to do something about them again, because this has been a process for me since I was 28 years old, but when I had knee surgery, that surgery, all the inflammation and swelling and lack of good circulation made it even more painful than it really needed to be.
Mm-hmm. And veins, that's not uncommon. You know, vein conditions, it's largely a genetic thing. And when it's going to manifest varies from person to person, but it's a lot of genetics. And in your particular case, it started young. And then the pregnancies on top of that really do a number on a vein that's already
not that good.
Predisposed or set to do bad things.
And then if you're super active on top of the genetics, on top of the babies.
Right. And then if you don't have the precautions of wearing compression stockings, which are at the time when you were having babies, they were not super sexy and very stylish.
They're still not sexy. They're still not sexy.
They've gotten a little better. But
mine are thigh high. They have lace on the top. They still are not sexy. I'm sorry.
All right, fair enough. But, and plus, we didn't push them like we do now. We understand that compression stockings.
I did wear them pregnant, though.
Did you?
Mm-hmm. I had to.
All right. Yeah.
I had to.
Yeah.
But they're probably pushing it more now for women, maybe not as bad as me.
We recommend compression stockings for everyone. Everybody should be wearing compression stockings. Not necessarily all the time, but long car rides, long plane rides. I mean, any situation where your legs are just sitting. Because there's no heart down in your feet to pump blood. Mm-hmm. So blood is likely or can just pool if you're just sitting, again, for long car rides, plane rides. The calf muscle. Yeah,
but is that everybody so as a fit, youngish, healthy person, or for somebody younger than I am, who's going, look, I'm fit, I'm healthy, I'm active. Why would I need to wear compression stockings?
Right. Well, for two reasons. Number one, vein problems are very common. At least half the population has some degree of vein issues. And by the time we see you, at whatever point in life, the process started long ago. And so the longer we can defer it, delay it, prevent it, so much the better.
Can you really prevent it?
Fair question. And I guess the short answer is not really.
Yeah.
Depending on how genetically programmed. In your particular case, you're very genetically programmed to bad veins. Other people may not have that same degree as your veins, in which case then things like weight become an issue, activity becomes an issue, other things that can make a vein go bad. Gravity is not our friend when it comes to veins. And blood gets pulled down when you're upright and standing and active, and to your point, pounding, with those activities. That puts a lot of pressure on those valves that are inside those veins that keep the blood going against gravity back up to the heart. And so I don't want to say don't do those types of activities, but
struggle's real.
But again, unfortunately, it comes back to the compression stockings. If you could wear some kind of support to help
like
those.
Little hot cute shorts and then stockings. The thigh high with a little lace. Here on the screen, this is your vein. This is your vein on drugs. Now, this is my vein.
Your vein. This is your vein
famous.
Right here in all its glory. Just by quick orientation, this is the tissue in the leg. This is the surface of the leg up here. This is deeper down. This black dot.
The black hole?
The black hole, that is a vein. And that's normal. Everybody has those. And so if we did an ultrasound, we're going to see that black dot on everybody. We're not going to see as large a black dot on most people. This black dot is larger than it should be. This is in about the mid-thigh. And a vein at that level in a petite, thin female should be about 2 millimeters, maybe 3. And yours is measuring at 4.5 in its transverse diameter.
I mean, go big or go home.
That's it, yeah. A couple things when we're measuring the function of a vein. We look at the size of the vein because, again, as we talked about blood pools, and when you're standing upright, when that blood goes in the tube starts to stretch because it's holding extra blood that's getting pulled down by gravity. That's one. But the reason it's pulling in the first place is because those valves are not keeping it out of the vein. And so those valves are supposed to be one way, so the blood will go up and then get caught by that valve. Those valves are what fail, so that's what allows the blood to drop back down. We could measure the function of those valves as well. This little gray line, that should not be there. What we're measuring is the flow of blood coming back towards our ultrasound probe. And normally there should not be any after about half a second or so. And yours is continuing on, as we could see, for over 1 second, 1.2 seconds.
Lovely.
So it's taking that long before that vein can gradually come and stop the flow of that blood.
And you guys, this is men and women. So the question is, what do we do?
So, good question. When it gets to the point where a vein gets to this size and function or lack of function, there is no value of this vein to you at all.
And I can live without this vein.
Correct. So veins, there's lots of redundancy built in the vein system. But when they go bad, we do have the ability to take them
It
out.
basically reroutes on its own.
Correct. We close it down. We leave it in place, but we close it down. And the whole idea and the concept is to prevent blood from accumulating in this big straw. How we close the veins down, there's different techniques that we use to close them down.
And so how do you decide based on person, or you just have one way that you like to do it?
No. We will sometimes use different techniques depending on anatomy. What we're trying to do in these types of situations is we're trying to redirect blood away from the skin into the deeper veins. As I mentioned, the skin's up here, deeper veins down here. The deep veins we don't mess with. You have to have something. We can't close every vein down. Obviously, there has to be something that drains blood back. And so what we're trying to do is direct the blood that normally, because again, from here, from that black dot that we saw earlier, it's going to work its way up to the skin. And it's going to cause spider veins and varicose veins.
I was just going to mention that because
discoloration.
You might not have big ugly veins on top yet, or you might never, or you might, and they kind of coincide or not coincide.
Yeah, that brings up a great point. The actual varicose veins that we all think about, the big dopey-looking things that we see on the skin, that also has a genetic element to it. Mm-hmm. So some people are very prone to developing the big, gnarly varicose veins with relatively mild reflux. Other people can have severe reflux and not really have varicose veins or not much visible at all.
Mine are not really that visible.
Really, from a medical perspective, the reason we're doing this is for quality of life. None of this is dangerous or life-threatening. Right. This isn't going to take years off your life or add years to your life or anything else. Really, it's a quality of life. But for somebody that's young and active, we want to keep you young and active and keep you going. And again, coming back to that whole straw thing, it literally is that. It's pulling blood back down into your leg. By the end of the day, when you've been upright, you're carrying several extra pounds of blood in your legs. And so you may not even understand why you don't feel like exercising or staying active or why you back off in exercising. But this is one of the factors that can affect that. If your legs don't feel good, if you're carrying extra weight down there, then that can affect your mobility and your activity and can then have that trickle-down effect.
I'm super excited about this. You guys are going to get to follow the journey, but I also want you to know that when you come in here, Dr. Mehta is not just about doing your veins, and his background is cardiology. And you know, as you and I are both getting older and we're in this business of health and wellness, you've dealt with dying people, saving people, heart problems. You started realizing, there's more to this. Like, there's the backstory. How can I help people before they get on this table?
Correct. So we do a lot of longevity, wellness. We do hormones, hormone replacement therapy. We do a lot of work with peptides. We do epigenetics.
Come on in here. Knowledge is power. Find out how he can help you. Find out how he can enable you to live your best healthy life, because you only got one life to live.
Exactly right.
How do you dance to this one? All right, you guys, come on in here.
Bye-bye.
Oasis Vein and Vitality.